There was another reason why so many elderly died during the first wave in the spring of 2020. And this is where it gets really shocking. In March 2020, the British people were told to stay at home in order to protect the NHS and to save lives. The authorities just needed 3 weeks to flatten the curve. What happened in those 3 weeks? First of all, many hospitals were ordered to move elderly patients with respiratory problems to care homes. As many as possible, which is rather strange when you think about it. I mean, people are not administered to a hospital for fun, right? But it happened. On March 19, a directive was sent out to the NHS saying all patients who did not require a hospital bed had to be discharged, as in right now. The NHS workers were obliged to follow the new directive. They had precisely 1 hour to get those patients out of bed and into their clothes, after which they had another 2 hours to take them from the hospital to their new home, in most cases a care home. Did those patients have a voice in this at all? No, they did not. Their beds had to be empty for COVID-19 patients, those poor sufferers of a virus that had not been proven and would never be proven to exist. This directive was most efficient, as you can see in this graph. Only 62% occupancy of hospital beds remained, 30% down compared to previous years. So, what happened to those patients who ended up in care homes? They were euthanized. Do we have evidence for such a brutal claim? Yes, we do. But we must warn you, for this is truly as ugly as it possibly gets. You might even realize for the first time what happened to your parents or grandparents and why they suddenly died. You see, all of a sudden, in April 2020, there was a great increase in deaths in care homes. No less than 26,541 people died in April 2020 alone, an increase of 17,850 on the 5-year average. That's an awful lot of excess deaths in just 1 month. What happened? They were given Midazolam. That's what happened. But you weren't told, were you? And neither were they. Midazolam is a very strong sedative, used among other things to relieve anxiety and fear. It is also used in lethal injections in the US, combined with 2 other drugs. The NHS workers were told to ease the suffering of the patients who were removed from their hospital beds and were now in their care home beds. Most of them had respiratory problems, so wouldn't it be nice to give them an intravenous cocktail of morphine and midazolam? Sounds sweet, doesn't it? Well, it wasn't. You see, midazolam affects the central nervous system, and thus a person's breathing. Midazolam is the last drug on earth these patients should have been given. It causes shallow, slowed or temporarily stopped breathing that may lead to permanent brain injury or death. Furthermore, midazolam is dangerous for elderly patients in general, also for those who don't even have breathing problems. If given at all, it should be done at a very low dosage. This is what would have been safe, according to a policy that was in place before the COVID-19 outbreak scam. A dosage for the elderly should not be greater than 0.5 milligram, max 1 milligram. However, during the outbreak, this policy was changed into the following: a starting dose of 2.5 milligrams and, if necessary, pump it up to 5 or even 10 milligrams. Who on earth changed these policies? The same people who had those thousands of patients removed from hospitals to care homes. The same who advised administering Midazolam in the first place. The same who knew damn well what the effects would be. The very same who ordered insane amounts of Midazolam at the beginning of 2020. So much so, it had to be imported from France. That's right, a 2-year supply of a killer drug was imported from France. It was all used up by October of that same year. Not as part of the anesthesia during surgery, as was the official explanation. There were no surgeries during these COVID months. They were postponed by the same criminals, guilty of genocide of 26,500 people who died in April 2020 alone in care homes. Those people choked to death. Midazolam side effect, significant depression of respiration, killed them. They suffocated. What was written on their death certificates? Cause of death, COVID-19. Who are the criminals behind this evil scheme? Secretary of State for Health and Social Care, Matt Hancock. GP and Member of Parliament, Dr. Luke Evans. And the Department of Health. Here they are, deliberating their Midazolam stockpile to make sure they were ready for the kill.
A good death needs 3 things. It needs equipment, it needs medication, and it needs the staff to administer it. So in terms of equipment, a few quick questions. Do you have enough syringe drivers in the NHS to deliver medications to keep people comfortable when they're passing away?
Yes, right now we do.
And the second one is with that's to the syringe drivers deliver medication, particularly things like Midazolam and morphine. Do you have any precautions put in place to make sure we have enough of those medications to be delivered?
Yes, we've got a big project to make sure that those sorts of medications, as well as the ITU medications that I spoke about earlier, that the supply chains, the global supply chains for those medicines are clear.
The so-called good death Hancock and Evans talked about means euthanasia. What you just witnessed was part of a parliamentary committee meeting in which euthanizing the elderly in care homes by means of Midazolam and morphine was openly dealt with. Did they act on their own accord? Of course not. The Department of Health, Prime Minister Boris Johnson, each and every puppet of the cabal presently seated in the British government were part of this grand euthanasia scheme of the elderly, as part of the global sustainable development goals and thus the depopulation agenda. Shocking to see it in action, isn't it? Yet another must they pushed down the throats of the NHS workers was to add a do not resuscitate notice on the files of the care home residents. If their hearts or lungs stopped working, that was it. No resuscitation, please, as that did not exactly fit the depopulation agenda. Just let them die, the useless eaters. Oh, and of course, nobody told the residents or their loved ones a thing. The 3 weeks the authorities needed to flatten the curve was invented to intentionally end the lives of 26,500 people. That's why the British people had to stay home. Not to protect the NHS or to save lives, but to let the cabal execute their evil euthanasia program. This didn't just happen in the UK. It happened in Australia, the US, and in many other countries. When Wayne Smith unraveled the Midazolam scandal after his father died in his care home, he exposed what he had found. He was subsequently found dead in his home in August 21. Rest in peace, Wayne Smith, and all Midazolam victims. You will be remembered.